because this is going to be the best class ever. All right. Oh, there he goes again. I didn't pay for this attempt at humor. Yeah, that's exactly what it's worth. Nothing. All right. Chapter 6, Biological and Chemical Agents. So, hello, everybody. All right. So, we're going to deal with, again, some terminology relating to the chemical and biological agents, the management, obviously, of those, and some actions when it comes to chemical and biological agents on human physiology. So, where you people have worked in the past, what has been your experience with chemical and biological agents? Have you worked in a place that, I mean, pretty much any place you can think of has certainly chemical. It could be toner in a printer cartridge. That might not seem like what you were originally thinking of. How many of you have some experience with this? Because I'm hoping somebody says they have a lot of experience and then they can just teach the rest of the chapter. How about that? All right. No. Anyways. So, chemical agents. So in this particular case, biohazards is talking about, unfortunately, this is something that we've been talking about for, it's now 7 months, I guess. Yes. Infectious microorganisms, proteins, and nuclei acids. So the types of as a biohazard. And it affects where traffic goes. There's dangerous goods routes. I would certainly think that Portage la Prairie has a dangerous goods route, that if any of these chemicals or biohazards are being transported in the community, there's only certain roads they're allowed on. And the same kind of mentality would apply to your situation where in a workplace, you have to keep them contained. They can be very dangerous. And then, of course, chemicals, which chemicals can be all kinds of things. Like I said, it could be something as innocuous as toner cartridge, and things along that line. It can be sulfuric acid. All right. So, and we actually saw some of this recently with the ricin letters that were going down to the States. So you can see salmonella, anthrax, some very dangerous sources and occupations. So, this has become a worldwide issue, and they're finding COVID in all kinds, in water and food, and they're saying in certain types of sources it's not it's not communicable, so you can't transfer from one person to the next. And there was a lot of debate at the start about COVID as to whether it was transmitted by like air. That's why we're supposed to keep the 6 feet apart, right? So again, this is just some sources of where would this come from. So you have to be careful of this. And the people in healthcare, which I used to work in, are very well aware of this. They have precautions in place before this happened. And have any of you in this room, actually reminds me I should probably get mine updated, but have any of you in this room ever traveled overseas where you got hepatitis shots before you went to certain places? Oh, it's something you may want to consider if you do travel especially to say like, well, the ones I'm familiar with, the Caribbean or Mexico. So, and usually those shots last for about 10 years, which is reminding me that I should probably get mine updated. So you don't develop hepatitis. So this just tells you what to avoid, who the occupants or what occupations are more likely to encounter this. Salmonella and food poisoning. I would go so far as to say pretty much all of us have had experienced food poisoning. Does anybody in the room want to share a story without being perhaps too graphic? Who in the room has had food poisoning?
I think I might have.
Okay.
It wasn't pleasant.
Yeah. Thank you for not being too graphic. It's not very pleasant. Okay. Yes. When was it about? I think it was like a year and a half ago. I'm sure. Yeah, I'm sure I got food poisoning. I lost like 8 pounds in 3 days. So it's a forced weight loss method. I hardly ate anything for literally 3 days, 4 days. It's not something you want. So it's even simple things like storing food properly. Uh, and putting things in the refrigerator, etc. And they'll last certain lengths of time. All right. You need to. I think we should be very well aware of this in today's world. We talked about it recently as far as like taking people's phone numbers and contact information in case there is an outbreak. I know that I was reading about like 2 people who went out drinking in Ontario, and apparently they like did some bar hopping, so they infected 5 bars because they both had COVID. So you need to track those people. Now all the people in that are are at risk, and I think you've probably heard the news that the president of the United States has COVID, and so does his wife. I think you've probably heard that on the news.
Yeah, just today.
Mm-hmm. Yeah, we won't get into the politics of it. We'll just leave that for the Americans to decide. But it's yeah, I have a close personal friend who lives in Milwaukee, and just we talk quite regularly, and she's telling me that down there it's almost like they're under siege with all the protests that are going on, with the fighting amongst the politics, and then Black Lives Matter and all of the stuff that's going on. And she's very into her thesis was segregation in Milwaukee. Milwaukee is actually one of the most segregated cities in the United States. That's what she did her thesis on. And yeah, so she's very much into this, but it's like, yeah, she just says it's just, you just want to go home and stay home. It just feels like there's an apocalypse coming on. So again, you can see the circle here, chain of infection. And again, one of the nice things that people should have that you couldn't before. In a lot of your courses, you may be allowed a reference sheet. I mean, students like to call it cheat sheet. But in this particular case, with your midterm exams coming up, one of the things that may reduce your stress, I'll try and help you reduce your stress for the 2 courses that we have together, is when I see the midterm exam, I'll try and refer to certain slides in particular. So this might be one of the slides. I don't know. I haven't looked at it yet. I'll look at it pretty soon. So I might say, class, you may want to have slide number 7 from chapter number 6 for workplace health and safety. You may want that readily available. So that's the kind of hints I'm going to give you. So you don't have to memorize this like you might have had to in the past or write it on a reference sheet. you have access to open book and open note. So this would be something that there might be a question on the test of like, what is the chain of infection? And it could even be a short answer question. Well, then you go like agent, reservoir, etc. Portal of exit. So I don't know, but if I was a student doing this, that might actually ease some of my stress, because I know as soon as you say the word test or exam, people's blood pressure goes up and their anxiety goes up. But if we organize ourselves, which we're going to start to do even next week in the 2 courses, then honestly, I don't think you're really going to need to do a whole lot of studying outside of class time for these 2 courses. That's my goal. My goal is that you're really well prepared for the midterm exam for this course and project management. And yes, okay, some of you will do studying outside, but also understand you got 4 other courses to study for. You've got 6 exams to write that week. So I'm going to try and be very focused. All right. So I think a lot of this is fairly straightforward. The reservoir is simply where the biological agent grows and multiplies. The exit, it could be, this is what was talking about with COVID, is like respiratory tract, or some items, like there was a lot, you people are too young to remember, but there was a lot of concerns when HIV or AIDS started becoming, let's see, in the 80s, 1980s, where AIDS really started to become more aware of that. There was a time where people thought that AIDS could be transmitted like by breath or over the air. We now know, your generation will look at that and what? Yes, but when it first came out, they didn't know. So, we know that AIDS can be transmitted via blood or some other biological fluids, but it doesn't, and it doesn't actually transmit by air. Thank goodness. If it did, that would be a whole lot of world of hurt for a lot of people. Just like their treatments for HIV. When I was your age, if you got HIV, you were like, okay, that's a death sentence. And now people can get that and live a very long life. So the mode that it's, or channels of which the agent is carried from one host to another. How it enters the new host. And we're seeing, all right, is the host susceptible to the infection? In some cases, there needs to be a break in the skin. If you, and of course, more, I'm sure you've heard lots about this recently about the people who are at risk, people who have diabetes, people who have high blood pressure, people who have, I know one of my colleagues, he's got health issues. It's almost like sort of toxin in his body and he's very much at risk. He's sure that if he got COVID, he would die. He's absolutely convinced of that because he's had some major health issues. Whereas young people like yourself, you might get COVID, but your chances of succumbing to it are fairly small. But just in between our break, the Mount Royal University here in Calgary has announced that they are going to have their winter courses online. So every single university in Alberta has said that they will have online courses for the winter. And I don't know what's going on in Manitoba, but not good is what I'm reading. Manitoba is, oh, sorry, go ahead.
We got an email from Red River this morning saying that winter term is going to be the same as this term. So.
Okay.
Yeah.
All right. Okay. So, yes, and that's not a surprise. I know when I talked to, it was actually Guy, I think it's 3 weeks ago today, I mentioned that, and he says, yeah, like, the administration was, or some people were just starting to come to the realization this is not just going to be over in even a couple of months. So, and again, let me get your feedback on this. So you've got a young group of people, and the likelihood, okay, if of you succumbing to the illness is very remote. The fact that you might get it, and like just like you would get a flu, is, but then it's also the kind of thing that you get COVID from when you go to school, and then you go home, and now you live with your grandmother, and you accidentally pass it on to your grandmother. You know where I'm going with this, so I'll stop there. Those are the kind of things that we have to factor in too. I have students who live with their grandparents, and they live with people who are at risk, who've got health issues. So thank you for that. I didn't realize. So Red River is online for the winter.
Yeah, apparently.
Okay. All right. So yeah, because I know when I talked to Guy like 3 weeks ago, and we talked about this, he said if we're online in the winter, they may have more work for me. So it's like, okay, right. Assuming they want me back, maybe they don't. All right. I don't try to get too far ahead of myself on that. So again, uh, Legionnaire's disease, which you probably would have to Google, that was way, way back, where there was an outbreak in Philadelphia. AIDS, I've already mentioned. Your generation is very well and educated on AIDS. When when I was about your age, was, let's see, yeah, maybe even a little older, is when we started hearing about AIDS. SARS, which actually, from my understanding, COVID is similar to SARS. It has some similarities to SARS. Fortunately, COVID has a much lower fatality rate than SARS did. I think the fatality rate with SARS was like close to about 9%. And with COVID, it's more like 3. And of course, the vast majority of people who pass away from COVID are elderly, as we're well aware, which is very sad. I even know recently when I went from my 50s to my 60s. So when I'm in my 50s, I looked this up as 0.5%. Now that I'm 60, it's now 1% chance that I will pass away if I got COVID. Right? Toxicity. I think we're quite familiar with toxicity. Causes injury to tissue. Aerosols. When at some point, do you wear protective equipment? If you like with aerosol products, have you ever been around a situation where you were to use aerosol products in your workplace, where there's sprays? These people would have worn masks before this, or proper ventilation. All right. Yep. And does anybody use anything right now that like even something at home like hairspray or some sort of spray, but because you use it so infrequently, you don't wear like protective covering on your face? Anybody?
I have like this like oven cleaner,
Mm-hmm. Mm-hmm.
which is super, super strong. Like you have to be in a ventilated area.
Mm-hmm. Mm-hmm. All right. No, that's a good example. And of course, I think some of us would just say, it's a good point, because normally I think a lot of us did not have masks around. But you're right. That's a very good example. If I was to put some oven spray in my oven, they're very noxious. Like they're very, you could pungent and but we just sprayed it. But I tell you, if I was going to do that right now, I'd put on my mask and then I would spray it. Then I would like get as far away as I can. So yes. Yeah, so aerosols, all right. So in this particular case, there's no toxicity data available for about 80% of the chemicals, which is pretty scary, right? You can get headaches, dry nasal passages, nausea, poisons, things along this line. All of you, all of us, have to be aware of dangerous chemicals in our lives, and how they get entry through breathing it in, skin absorption, you ingest it, or it goes through, it penetrates your skin, so it punctures your skin and goes in. Like I said, there are some items that my understanding is if it's on the surface of the skin will not absorb it. And my understanding of, and I'm no doctor by any stretch, but like HIV, that it needs to actually penetrate the skin. That's the one that comes to mind. And again, you people would have talked about this in your health classes at school, right? I mean, we didn't really have things like that not to the level that you people do. It's actually a shame that we didn't have more talk about that when I was in, we just talked about geography and history and, things along that line, which are nice to know things, but, just like personal finances and, did you people talk about this in health classes when you were in K to 12? Did you talk about personal health? And
Oh, that was so long ago.
okay,
I don't remember.
no, that's fine. Hey, if it was long ago for you, Amy, take your age and double it. Okay. Okay. And again, some of this is, I don't know, when I'm looking at this, I'm saying this is, you want to say common sense, respiratory tract, the nose. I don't know that you need to remember this in minutia, in detail. So I know, not to keep talking about myself all the time, but I may have had COVID earlier this year. There was a period of time from about the middle of March for 7 weeks. I had extreme coughing fits to the point where I didn't black out, but like the world would go woozy. Okay. And I found out eventually that's because of lack of oxygen. When you're coughing, you're not breathing. So if I felt a coughing fit come on, I would take a deep breath. And to this day, I still, on occasion, when I get really tired, like, late at night, I actually can hear these tiny air sacs, like the wheezing, what we call it, right? And I never in my life have ever had that. First time was last, I guess, April or so when I had that. And I'm now fully recovered. I do not have uncontrollable coughing fits, but I still noticed that I occasionally will wheeze, which I never did in my entire life before I had those coughing fits. So that's the little, don't ask me to pronounce the name, the air sacs. And so, ooh, okay. This is like, I did not know I'd be teaching medical, okay? Okay, class. We got the bronchus, right? I can't even pronounce half these names, right? I know what the trachea is. All right. Yes. Anyways, skin absorption. So we know our bodies. We know what they look like. We know the ways for things to enter our body through breathing it in, through eat or drink, or again, absorb through the skin. Sometimes you put things on your skin and you want the skin to absorb it, like say lotion for dry skin. All right. And and certain people are more susceptible than others to this. Like if anybody has asthma, which is also, by the way, I did not realize this for a long time, but asthma is also related to um, eczema. They're of the same family. That people with asthma more likely to have eczema or vice versa. And again, you can see may produce irritation. Every one of us at some point has had a rash, right? Through, in this case, caused by chemicals. You know, in some cases, you've had a rash because of sweating or something, you know, and then blisters, right? Again, if anybody's ever gotten a severe sunburn, that's also incredibly painful. Not just talking about like a regular, I'm talking where you get blisters or boils on your skin. Yes, it's happened to me once in my life and something I never want to experience again. Again, ingestion, smoking, inhaling, things along that line. I'm sure you've seen, you know, where people breathe it in and again, it's absorbed into the lungs or the bloodstream. Again, perforations or cuts in the skin. This is part of the reason why we put Band-Aids on, right? Or we definitely cover it up. You have to be extra careful if you have a cut in your skin or puncture or perforation, whatever you want to call it, as it makes you more susceptible to chemicals entering your body. So there are certain, does anybody know an example? I gave you one. Does anybody know an example where you can put something on your skin and it's okay, your skin will not absorb it, it will not go into your blood, but if there's a puncture or a hole, it will go right into your bloodstream. Does anybody happen to know something beyond what I said earlier? I'm not a, all right, I guess not, all right? All right, and again, low-grade infections to HIV. So, again, some of the properties that make the solvent. Hang on. Whoops, going the wrong way. Here, I want to move something out of the way. Sometimes the screen gets in my way. So again, this is just hazards of solvents and that you have to be aware of, things like low boiling points, high pressure, vapor pressure, highly volatile. You've seen the signs. You've seen the signage on this, and you know, have any of you taken WebEx? Do you know what I'm talking about?
Yeah, I took it, was it in our first year?
Okay.
They offered it with RRC.
Okay. And it's good to add, by the way. Another thing you might want to add, and it's actually fairly inexpensive for students, is if you work if quality, you can get various levels of certification. And for students, it's something like $10 to get a certification in, I think that's a yellow belt. They have yellow, green, black. And for students, if you want to add something to your resume that's perhaps somebody else doesn't have, for student, I know they do it at SAIT, for like, and SAIT even pays for it because it's like $5 or $10, something really small to get a yellow belt in quality. So sorry for the sidetrack. All right. You got acids and bases. I feel like this is chemistry class all over again. All right. Sulfuric acid, hydrochloric acid, again, corrosiveness. Some of you, if you bleach something, of course, you should not bleach something unless you're wearing protective equipment or gloves, things along that. Even to a degree, things that like in hair salons when they're dyeing people's hair, and they will wear gloves. or, you know, sometimes they'll bleach somebody's hair. Alkalines, sodium chloride, and right, and you can see less refined is road salt. So some of this we take in on purpose, but too much is bad. Table salt. All right, sodium chloride. All right, organic. So you can see they're petrochemical based, they're manufactured, and I don't think that we need to go through, although probably. Again, if this is on your midterm exam, like it asks you about alcohols and give an example and then give the toxic effect, some of you at some point in your life may have experienced some of the toxic effects of alcohol. I'm just saying, right? All right. Just saying that perhaps somebody in this room may have had nausea or a headache because of alcohol. All right. We're talking perhaps a different type of alcohol, and we know enough. And unfortunately, you know, there are people who, for various reasons, ingest willingly some like ethyl alcohol. We know that some of those, like, you know, there's alcohol to a degree that we can buy in the stores that is safe up to a certain limit, you know, a certain amount of consumption. But I know that there are certain, like substance abusers, they will ingest ethyl alcohol. And that is very dangerous, including causing blindness. And I know, I would imagine it's still an issue on some of the, well, it's not just related to Manitoba, but I remember in my, of course, I grew up in Manitoba. I lived in Manitoba for 23 years. And I remember, and like I said, I imagine it's still an issue of having, especially in some of the First Nations locations that in the winter are very isolated, that kids will go out and they'll sniff gas from the snowmobiles. Is that still a major issue? I suppose even one person would be a major issue, but still things like that, like sniffing gas fumes, which cause permanent brain damage. Does anybody know? But some people do it on purpose, is what I'm trying to say.
No idea. I never heard of that.
Okay. All right. I know there were some communities, First Nations communities in northern Manitoba. I think even places like Lynn Lake and stuff like that. But then some people do it on purpose. Right. So what you're trying to do is, in this particular case, is substitute. If you can find a less hazardous solvent, that would be good. That still does the job. Exhaust or ventilation. Closed systems, which means it would be exactly that. What I mean, in one of the tours I go on, they have a paint area. The people go into the paint area, and of course they have the you know, those white protective like covers. They also, of course, have ventilation. They also have safety glasses on. It's ventilated, but they also basically close the room. So the smell of the paint and varnish in some cases does not escape from the room. Yes, there'll be a door. So they try and ventilate. They protect the person. They may also, one of the things that's not mentioned so far is rotating people. Like making sure a person doesn't do the job for too long. If you go and put somebody in a room like that all day, it may be very unpleasant. They're in this tiny room, they're sweating, they've, it's not a very pleasant job. So they might rotate that job every hour or every half day or whatever the case would be. That's one of the ways to also deal with it. But in this case, what I'm trying to say is they have a closed room. So it's self-contained or enclosed. And again, especially in today's world, you have to be very careful. You can't just be, the mining company I used to work for, they would say smelter smoke, but it would cause acid rain. Even way before you people were born, they built a new stack, so it would spread out because it was killing the trees around my hometown. Years ago, places like where is it? Sudbury. Did you know this? That when they were preparing for landing on the moon, they went to Sudbury to do training because they felt that was the most that was the closest to the moon they had in North America. And one of the reasons why is they had acid rain from Inco in Sudbury, and it killed the trees. And as far as I'm aware, there's no trees on the moon. So yes, and there was a lot of money spent on trying to correct that. So engineering controls. Again, here's some safe practices. I don't know about you, but there's no way in the world without a whole heck of a lot of studying that I would ever memorize this. And guess what? I don't need to. So here's control of exposures. So just go through a few of them. Substitute with less hazardous solvents. Great. You people, all right. I just thought of something that you might be able to relate to. Nail polish remover. Nail polish remover can have an acid in it, can it not?
Yeah.
Okay. But there are also nail polish removers that do not have acid, correct?
Probably.
I've seen them. Okay. I've seen them. And so that would be an example. The reason why I mention that is there's an example of anything with an acid in it, is potentially more irritant and have or even mouthwash, with alcohol in it. It burns. And now they have mouthwash without alcohol in it. So the point that I'm trying to make, and the reason I mention personal examples, is you go to the store and you see, oh, nail polish remover. Oh, and I know they have ones without acid. That would be an example of trying to substitute with a less hazardous solvent. Does that make sense? That's an example that I can think of. And I try to use examples that are in your own personal lives, because sometimes students just think, oh, that's just related to when I go to work. This has no effect on me as a person in my day-to-day lives. You can also see labelings, MSDS, material safety data sheets, good housekeeping, at proper waste disposal. We've talked about that before. Protective clothing, respirators, face shields. Would you agree with me that suntan lotion is a protective skin ointment, like SPF 30?
Yeah.
Right. Showers, in case somebody gets something spilled on them. I would also put in things like eye wash stations, etc., in case somebody gets something in their eye, etc. All right. So here's just some of the practices in the same as the previous slide. Honestly, why they have this, I'm not sure. Closed systems. So this is just kind of redundant. Again, you need to receive training. Okay, I'm going to pause for a moment because I've been doing all the talking. I want at least one of you to tell me an example of where you receive training on how to use personal protective equipment, a respirator or whatever it may happen to be, or handling and control of agents. I'm going to wait. I'm going to wait. Somebody must have received some training somewhere along the line. None of you have ever received training on how to use personal protective equipment.
I've never had.
Okay.
Not to work with chemicals and stuff, but I've had to wear like gloves and stuff when working with clients as when I was a support worker.
That works for me.
Okay, that's it.
Yep. So again, sometimes it's like we were talking earlier today. It's like sometimes it's just much simpler than what it is. Is wearing a pair of gloves. Yeah, if you're a landscaper and you're dealing with, wearing a pair of gloves is personal protective equipment because there might be chemicals in the dirt and stuff that you're dealing with, or of course people who are spraying, to kill mosquitoes and stuff like that. Like those giant mosquitoes they always have in Winnipeg. All right. So yes, that's exactly what we're talking about. You people do this when you go to clean your oven. All right. First of all, you get somebody else to do it. That's the first alternative, right? When you go to clean your oven, do you wear gloves? If you don't, you probably should, right?
I didn't. Yeah.
Amy, Lily.
I didn't have any.
Oh, Amy.
I was just really careful.
He was just really careful.
Mhm.
All right. So the first alternative is get somebody else to do it for you. The second alternative is wear gloves next time. All right. I'll send you some on Amazon. If you go to clean your oven, I'll send you some. You should not be putting yourself at risk, no matter how careful you think you are.
I only clean it about once a year, so it's good.
Yes. All right. Well, you know better, Amy. You know that this is not setting a good example, okay? All right. And of course, familiarity with workplace, uh, with WEMIS legislation. All right. So with WEMIS, Workplace Hazardous Material Information System, right? And I remember when WEMIS came out and the MSDSs, Material Safety Data Sheets, which all organizations must have. It is law that you must have this. And it deals with, you might say in an office setting, I'm going to be working in an office. First of all, you people are going to be involved in organizations that do have this. And with your type of job, the reason why you would take a course in workplace health and safety, it is your job to make sure. A lot of you this will be a responsibility, say in HR or whatever. It'd be your job to make sure the organization is following these rules, that you sit on occupational health and safety committees and you say, is there a new chemical? Is there a new is there something we can replace this? Because our workers are getting hurt. We're sending workers home with skin burns on their skin, right? This is bad in so many ways. It's not good for morale. You talk about morale being poor. Yeah, well, look, I've got this terrible burn on my forearm because of the chemicals. I wasn't trained how to use the chemicals properly. I wasn't given the proper equipment. This is obviously a major area. And even if you say you go back to your safe little office, like I said, you might think it's a joke. I'm not joking. Things like toner cartridges that I've said like 3 or 4 times already, there was a time, that the toner cartridges were only supposed to be replaced by the IT people because if people were messing up, they were breaking the printers. But also there are chemicals in there. I'm sure nobody in this room would deliberately ingest toner cartridge, let alone you get it on your skin or something along that line. You go wash it off. So you people will, even if you're in your safe little office and you feel like, oh, I'm pretty safe. Here you are compared to some of the people working out in the facilities. You need to be involved with work. There's one day I can see some of you in this room being the person who is teaching this. I can see that fairly easily. That Amy, Jennifer, Mary Lou, whoever else is in class, right? Viviana, Regine, Sean, I can see you people doing this, leading this, or at least giving, talking, sitting. Am I wrong, or do you think that one day you'll be sitting there and you've got some new employees and you're having to explain to them workers' compensation? That if you have an injury, this is what you do, making sure the policies are current, making sure the minutes are available. So when Manitoba Workplace Health and Safety comes along, you have your records in order. Who do you think is going to do that? People like you, from what you've told me. Am I wrong? Like, do you have a different perspective on it? Can you see yourself literally leading the training on this?
Yeah.
All right. So if Amy says yes and I say yes, it's got to be the right answer, right? Because both of us couldn't possibly be wrong, right? And again, new labeling systems came out in 2015, and again, has grouping things into, or hazardous materials are grouped, classified, and put into categories, etc. So these are the various categories that they have and the types. The labels, you've all seen these labels, yes? We know the label on the left with the skull and crossbones is don't swallow it, right? Or fatal if swallowed. And any of you in this room, and I know I brought this up once before, you know this, especially like somebody like Jennifer who has kids. You have to be extra careful on things like say liquid plumber and things like that. I'm assuming that's correct, Jennifer, that you have to not just say, I know enough to not be swallowing liquid plumber, but I have to make sure that my kids don't even have access to it. I now put it in an area, I might even put it in a locked, literally locked, you know, so it's to a degree, that's the same kind of thing. It's just done at home. You people do this. All right. So explosives, we've all seen the flame, right? Oxidizing, right, may cause death, again, with skull and crossbones. Corrosive, gas cylinder, we've all seen these symbols, right? So environmental, which is kind of a new one. It wasn't always there. And even the one with it's kind of the person with kind of the burst in the middle. That's also a new one. And we've all seen the biohazardous. We've seen this. We see this in movies, for crying out loud, right? Is that not one of the ways they communicate with us in a movie? It's like, okay, you've seen a movie where there's you've all seen this symbol, which has got the circle and the whatever those things are. They're kind of like C's, all right? Right. So we all know what the symbol for biohazardous infectious materials. And again, if you're dealing with somebody who's young or you're dealing with somebody who's new, you need to make sure that they're aware what these symbols are. I don't know about you. When you look at these, what are there, 10? I would anticipate that probably fairly easily, especially if it was one of those matching questions where you had 10 symbols on one side and the explanation on the other. I would honestly think that even without this course, you should probably get at least 6. Some of them are fairly obvious. The flame one, even the gas cylinder, the skull and crossbones, the biohazardous, exploding. I would think that those would probably be something that you've seen enough in your life and are familiar with. I said the environmental one was it okay? So it's something that's is more current, right? Material safety data sheets. They're actually normally called material safety data sheets. Identify harmful materials. And it doesn't always have to be to the level of this is going to kill you kind of thing. It can simply be to the level of this is going to cause skin irritation. This is going to cause difficulty with breathing, things along this line. And I can't imagine almost any setting that doesn't have this. You know, it's if you've got gas for welding, obviously that has perhaps explosive capabilities, obviously very flammable. Respirators for personal protective equipment is very common, but you have to be careful. There was an incident here in Alberta a number of years ago now where a train derailed. I can't remember the name of the chemical, but a deadly gas leaked from one of the tankers. So the train derailed in Red Deer. And gas was heavier than air. So what that means is rather than it leaking from the tank and it just going up into the atmosphere, because it was heavier than air, you had this toxic cloud being, expanding from this leak. The respirators that the first aid people had did not have the correct filter to filter out that particular gas. And the cloud, because of the wind conditions, this deadly cloud of gas, of lethal gas, was moving towards a populated area. So you have to be careful. The point that I'm trying to make with this is respirators do not always filter out all of the possibilities. Respirators are limited and will filter out certain types of, particles and certain types of, say, gases, but they're not universal. So you have to be careful with that. I don't know about you, but I think, respirator, I put on a respirator, I'm safe. No, it depends on what type of, viral agent or biological agent or chemical or gas, right? And again, we're well aware that personal protective equipment for basically the entire body, any part of the body, whether it be your toes or whether it be your face or anything else, needs to be provided. So we can see the difference. Unfortunately, we become very familiar with the one on the left. I still haven't seen anybody walking around here with one on the right. But I've noticed recently, maybe I just was the other day, have anybody noticed more people wearing their masks while they're driving in their car? Or is that just the other day I saw it 3 times in like an hour?
Yeah, a few times here.
Okay, all right. I'm not going to criticize them, but I don't know. The first thing I usually do when I get out of a building is take my mask off. Unless
It's
there's a whole bunch. Oh, sorry, go ahead.
it's not so bad when they're like with other people because you don't know if they're like driving around clients or something, but when they're by themselves, it's like, what are you doing?
Yeah. Yes. Yeah, you're right. I mean, there would be people driving around. I don't know. I haven't been in a taxi or Uber for a while. I would imagine those people wear masks all the time, all day long. So that's not weird. That's, but you're right. When they're by themselves, and you're right, when there's other people in the car, you don't know where those people came from. That might not be a family member. That could be, a friend or, right? So again, we know this. No single piece of protective device is adequate. And again, we know that there's certain, in today's world, we've become very familiar with this in the last 6 or 7 months. If you took this course a year ago, this course would look very different on this, right? Because, oh, really? Like at least for how it's impacted us on a personal basis. I would imagine a lot of you never imagined a situation or thought it was so remote that you would ever be walking around with a mask. In Portage and in Manitoba, I know we talked about this before, but refresh my memory. I know that in Calgary, you have to wear a mask. It's by law. But yet you go to certain places just outside of Calgary, the restaurant, you do not have to wear a mask when you're in an enclosed area. But a lot of people are just doing that now when they, like, say, go shopping at Walmart. So what's the rule, and is it changed in Port Angel Prairie? You said it's kind of optional.
Yeah, it's still the same. I know places like Walmart, you do have to have a mask on. But most stores, it's just an option.
Okay. Well, my guess, and it's just a guess, is with what's going on in Manitoba right now. Because in the first wave, from my understanding, Manitoba wasn't necessarily too severely hit. But that's changed recently in the last two or 3 weeks. That Manitoba is being very hard hit by increases in COVID cases. And if that were to be the case, it may start to become mandatory, is my point. Am I analyzing that right? Like, you're in Manitoba, but Manitoba is being much more hard hit than it was before, right? And then again, one of the things you may want to ask is, ask people about medical conditions. One of the things that I've never had happen in a classroom is I had a student, and I'm sure I've had more than one student with this condition, but I had a student who came up to me in class. Actually, I had two. Come to think of it, I had two. Last year at Mount Royal, I had a student come up to me, and they said, I have epilepsy. All right. And they asked me, do I know how to deal with that? I have no clue how to deal with somebody who having an epileptic fit. So the student explained to me what to do. If this student started having an epileptic fit, about how to turn them on their side. I think from what I understood from this person is one of the real dangers is the person swallowing their tongue, choking that way. So turn them on their side so that they're not on their back. And I forget what else there was. Make sure that their airways, like, that, there was something else. Oh, put a pillow under their head or put something under their head, if I remember correctly. I have had two students in all my years of teaching come up to me and say, by the way, I have epilepsy. And just to let you know that. And the second student actually explained to me what to deal with, how to deal with that. So you should know that about your workers. If somebody, somebody can have convulsions or something along this line, you should know that about their employees. If there's a medical condition, right? Again, personal hygiene, and these days, I told you about my friend that works at Amazon. They actually have detectors in the building that will monitor people's temperature. So if somebody's temperature goes up, it will send a message to the manager that this employee's body temperature is increased. When they come into work, they're tested, and things along this line. So that's not personal hygiene. I get that, but they even have not supposed to be within 6 feet of each other. They get measured on that on a daily basis. And again, touching lips, nose, eyes with contaminated hands, and some activities are very difficult to do when you're in the healthcare field, or even if you think about somebody who's a masseuse. Somebody who does that, where they're physically touching. You can't get a massage where you're not touching the person. All right? Right. And how's that? Okay. So, questions or thoughts? We have one more chapter to do. We'll do it next week. And also now that I have some resources, which I only got access to a few days ago, we'll do some things like we do in project management where we'll have some discussions. So starting next week and the week after, we have 2 weeks till midterm. We still have some more new material in this course. We'll cover chapter 7. We'll go over chapter 7 on Wednesday next week. Or do you want time to work on your assignments in this course? What would you like next Wednesday? Any thoughts? You want me to decide?
What are the assignments again?
Okay, good question, because I'm just pulling out. Oh, yes. The assignments. Let me go into Learn. All right, which looks like it's closed on me. All right. So just bear with me. I thought I had Learn open.
Oh, there's that newcomer one.
Yeah, the newcomer one.
And then
So hang on, let me go. Yep, I remember that one. I don't know about you, but I find the Wednesday afternoon kind of weird because it's only 1 hour. And we have this long day on Friday. It's like, so, okay, hang on. So I thought I had it open, but I gotta go back into
a job.
Learn. Okay. So, all right. Like I said, I'd also like to give some people some time to work on. All right. Yes. So the first one was the one that we kind of like had. You could either do that case where there was the accident, or the health and safety regulations that I showed you in class. The second one is the newcomer one. The third one is job hazards.
When is that one due?
Which one are you referring to?
Oh, the job hazards.
I'm just looking at this. End of October.
Okay.
So just let me check. All right. Yeah. So just let me check. Yeah. So that one isn't due until after your midterm in this course. All right. Yeah. It's just a review of inventory and job hazards. So really, there's only the two.
Okay.
Because there's also those reflections, which quite frankly, I'm not a big fan of. All right. Don't tell Paul that. All right. Paul, he said he doesn't like your reflections. It's just when you give students 10 reflections to do and they're worth like 1% each, I just find that not productive. All right. So you have 2 assignments. And again, I want to give you some time. Okay. The first assignment was due September 24th, and the second assignment is due October the 8th. So let me change the second one. All right. I'm going to give you a little more time because I see 3 assignments submitted. All right. Okay. Oh, hang on. Wait a minute. That's the practice quizzes. Never mind. Where did they go?
And what about the reflections? We have to do the reflections?
I'm going to find a way to not do that.
Okay.
Because your people, okay. Don't worry about that 10%.
Okay.
Okay. Now where? Okay. There's also practice questions. All right. So hang on. So I'm going to extend the due date I'm going to give you an extra week to work on assignment number 2. As you heard me talk about in project management, I'm trying to be very flexible, but I want to put a little bit of pressure on you, quite frankly, to get some things done. That if you say, well, we'll be flexible on it, well, there's no pressure then. But you also have a long weekend coming up, not this weekend, but next weekend. You're going to be given class time to work on these. As you saw in project management, some of them are very simple, like 15 minutes, half an hour, maybe less. I don't know. So, and I'm not going to be too demanding, but I want to get some of them done. So you're going to have 4 assignments in this course after the midterm. But as far as the reflections and stuff goes, I'm not going to particularly worry about that too much. And part of it is I did say that I will also consider classroom participation. I now have access to the answer keys about a week ago for the reflections. I now see what they are. Your classroom participation, to me, is more valuable than sitting there and writing a 1-page paper on your reflections. That's my 2 cents. Right. There's also practice quizzes in this course, by the way. Just so you know, if you want to start practicing or getting ready for the midterm, if you go under assessments and then quizzes, I know that I think it was Regine. Correct me if I'm wrong, Regine, but you went in and did one, and you said you did really well without studying at all. Did I remember that correctly?
Yeah.
Okay. So there's material for you. I do want to get some assignments submitted, and I'll mark them, and so you'll have a good idea. Because I haven't marked anything in this. Maybe I'll do some of it this weekend. At least the ones like the first assignment in this course. Right. So, all right, that's about it for me. Thank you for agreeing to meet early. Did you like doing it this way compared to our regular way of doing things?
Oh, yeah.
Yes.
I
Yeah.
definitely like it this way.
Okay. Okay, that seems like a fairly unanimous heck yes. So, all right. I guess it's one of the advantages of having the same instructor and the exact same students in both courses, and that we can do this. So I'll put it out there. I think I know the answer. That starting next week, we'll do the same thing. Like we'll do it in, say, an hour and a half or so, take a break for half an hour, then come back and do workplace health and safety. If everybody's in agreement, if you're not, please speak up or send me an email saying you don't agree with that. So moving forward, we'll follow the same format as we did today.
Sounds good to me.
Yeah.
Sure.
Yeah, sounds good to me.
All right, excellent. If anybody wants to stay and ask me questions or get some help on an assignment, please do. But I'm done presenting new material for today. So the floor is yours. If you're going to sign off, have a nice weekend.
Okay, have a good
Bye.
lunch.
All right, take
Have a
care.
good weekend.
Take care. Bye-bye.